You so much, Auntie Felicia, and thank you so much, everybody, for being here. Greatly appreciated. I see we just had some new folks coming in. Just please be sure to mute yourself as you come in, as we are going to record this, and we'll be able to share it out. First, thank you all for making the time to be here for this emergency virtual town hall. And do know that on the 19th, we are hosting an in-person town hall at the Healing Cathedral, discussing many of the issues that we are today because we are in an emergency situation. xAI has been granted 41 gas turbines to operate in DeSoto County. The pollution is not going to stay in DeSoto County. It's going to impact our community, which anyone with a brain knows. Pollution doesn't know any imaginary boundaries between Memphis and Mississippi. We've been at this for over a year and a half, fighting for clean air for our community to stop the capitulation of our elected officials to industry and to listen to the voices of people in Boxtown, in Westwood, in Whitehaven, in Walker Homes, in Southaven, in Hernando, who are pleading with the people who are in positions of power to listen to the voices in our community. And too often we are being ignored. We've been told that we're just seeking clout. We've been told that this isn't a real issue. And then all of the science shows that we're on the right side of this thing. Even Trump's EPA has agreed that xAI illegally polluted our community from June 2024 to July 2025
Community.
with the help of our elected officials and with the help of our health department. These things have detrimental impacts to our community. And now we are standing up against the 41 gas turbines that are being planned in South Haven because of the negative consequences that is having. They rushed to a decision yesterday. We still had community members down there from Memphis Community Against Pollution, from Young, Gifted, and Green. And we aren't just, sending letters and trying to do things behind closed doors. We are fighting to make sure the right to clean air is true for everybody that we love and everyone that we care about. And that's why we're hosting this town hall and we'll be hosting another one. But I do not want to delay further. I want to introduce Dr. Michael Cork, who will be able to present to you the research that he and his colleague have done on the consequences of these 41 gas turbines. Facts matter, and we cannot allow the chamber's feelings or other people's feelings to get in the way of what's really impacting our community. That's why we have to have meetings like today so we can all share the same facts and information and know why we have to demand that city councilors, county commissioners, state representatives, U.S. Congress folks stand up, mayors stand up and speak up on our behalf and not capitulate just to billion-dollar industries and to billionaires. With that, I'll pass it over to Dr. Michael Cork.
Awesome. Thank you for the introduction. And I'm excited to be here and be able to share with you all some of the work that I undertook with the help of some of my colleagues at the Harvard School of Public Health. And this is looking at understanding the impacts of this proposed facility in terms of air quality, health, and some of the economic costs that would incur. So I want to start and just introduce a little bit about who I am and who Francesca Dormici is, who were the two of us worked together on this analysis. So I'm an environmental health scientist at Harvard T.H. Chan School of Public Health. And this was done in collaboration with Francesca Dominici, who is a professor and faculty director of the Harvard Data Science Initiative. So our work really focuses on understanding the health impacts of air pollution using a lot of modern statistical methods that is relied upon by public health agencies to determine, safe limits and understanding health impacts of different pollution events. This is going to be a summary of this report that I prepared for the Southern Environmental Law Center. And what this report did is looked at their proposed 1.2 gigawatt power plant that would be used to power the xAI data center in Southaven. And the air pollution and health impacts of this report, to our knowledge, have not been quantified. So our analysis looks to estimate how this proposed plant would affect PM 2.5 exposure. And I'm going to talk a little bit more about what I mean by that, but it's a type of pollution that's really important. How this would translate into health outcomes and some of the economic damages that would be incurred. I want to first step back and give a little bit of context on what is fine particulate matter or PM 2.5. It's, sounds very technical, but It refers to a specific type of pollution, and it's about size. The 2.5 actually is a measure of size. And to give you a little bit of intuition about how small this fine particulate matter is it's about 30 times smaller than the width of a human hair. Um, these tiny particles can penetrate deep into the lungs and can enter the bloodstream. So one of the issues is that, right, they're so small that they can actually enter, kind of cross over the barrier from your lungs to your blood. And PM2.5 or fine particulate matter comes from a variety of sources. So we actually, in our everyday life are exposed to this type of pollution from mostly kind of combustion. So like power plants, vehicles and cars, different types of industry. And so this graphic on the right shows all these different ways that we are exposed to PM2.5. So each of us has, a background level of fine particulate matter in our environment. And what we're analyzing here is if we build a power plant, how much additional pollution might it produce? So why do we care about this type of pollution? The reason we care is that PM2.5 is the air pollutant that is most strongly linked to serious health impacts. Major scientific studies show that around 90% of the health impacts from air pollution actually come from PM2.5. And when you're trying to understand the potential impacts of air pollution, it's really important to focus on this type of pollutant. There's also the most scientific evidence on this type of pollutant, and it's been linked to a variety of adverse health outcomes. Like it's linked to heart attacks, strokes, asthma, lung disease, and also premature deaths. I want to emphasize that this kind of pollution, there's no known safe level of long-term PM2.5 exposure. So if you have more pollution that's going to enter a community, that's going to translate into an increased risk of these different types of health outcomes. And this is important because even areas that meet federal standards, so the EPA sets federal standards of how much pollution a community should experience the long-term PM2.5 exposure. But even if it is below this federal standard, if you add additional pollution, it's going to translate into increased health risk. Another reason why it's important is that the Environmental Protection Agency uses fine particulate matter to estimate health damages nationwide. So it's been widely kind of established as a really important measure to understand health damages. With that being said, I wanted to, at a high level, show you what our analysis does. So we have four different steps. The first step is we start with the permitted emissions. So when this plant is being proposed, you are given an air permit where you're saying this is how much pollution is going to leave the plant. We're using that a maximum amount that was submitted as the amount of pollution leaving the plant. We also need to understand where that pollution is going to go. So what we do is we use a peer review. This is a model, a dispersion model, which estimates where the pollution is going to travel if it leaves the plant. As Representative Justin said, air pollution travels far, right? It is not confined to a single area. It doesn't respect any borders. So it's really important to understand when the pollution leaves the plant, who are the people that are going to be most affected. And this translates well to our third point, which is once we understand where the pollution is going to go, we want to understand who are the people living in these areas. What can we say about them? Who are the people that are going to be most impacted, and how many people are going to be impacted by kind of this additional pollution for the plant? And then finally, using that information, we want to estimate what are the health and economic impacts. To do this, we use Environmental Protection Agency Health Impact Assessment tool that is well documented to understand how many additional illnesses, premature deaths, and health damages might be associated with this amount of pollution leaving the plants. Okay, so now that I've explained a little bit about what our health analysis does, I want to show some of the results that we highlight in the report. And I also want to remind you that this report is available online and you can access kind of the full report after this as well. So I'm going to start with this figure, which is looking at the regional impact of the plant. So first on the left, you see this is looking at an area of the US. And on the lower right-hand side, I have this little map inset to show you that this is located in kind of the intersection of, we have counties of Tennessee, Mississippi, and Arkansas. Now, the blue dot shows the location of this proposed facility in DeSoto County in Mississippi. Note that it is pretty close to the border with Tennessee. And the counties are labeled with certain names, with the names of the counties. What I'm showing here is the dark is each census tract within a county is colored by the amount of additional pollution that it would incur, or we estimate would incur from the plant. And the darker red is corresponds to higher levels of concentration. So what you'll notice here on this legend on the bottom, I have PM2.5 and I have these symbols of micrograms per meter cubed. What this is, it's a measure of concentration. You can think about it as like a cube, and we want to know how much pollution would fit into that cube. So it's understanding how much concentration of this pollution would translate to these specific areas. What you'll notice here is that most of the pollution occurs near the plant, which is what we might expect given um, how this is a point pollution source, and that it also travels, across the border and kind of concentrated in the kind of Shelby and DeSoto counties. I want to show a little zoomed in version. This is the same information conveyed, but now we're kind of zooming in closer to the highest impacted areas. Again, I have an inset on the lower right-hand side to just show you like there's the kind of outlines of these states to understand what we're looking at. And what you can see is that again, it's really concentrated in DeSoto, Shelby County, and we again have this measure of PM2.5. So one thing that we did in the report is we want to translate to people, okay, what does this mean, right? What an increase of, 0.25, zero point 0.5, or 0.75, how can we intuitively think about what that means in terms of population risk? So one way I've done this is to think about a long-term increase of about 0.15, which you can see here is kind of this like lighter yellow color on the map, is linked to about one additional death per 100,000 people per year. And this is by taking the concentration, multiplying it by this coefficient that is derived from epidemiological literature, and translating it into deaths. This is something that's really common in the scientific community. For context, a one additional death per 100,000 is similar in scale to the average risk of death from influenza in the United States. The way of thinking about this is if you are in an area that has a long-term increase of 0.15, it's creating an additional risk of one additional death per 100,000 on average, and that's similar to the risk of death from influenza in the United States. Another kind of helpful anchor is that a long-term increase of about 0.5, which on this is kind of at the center of the scale, so it's kind of this orange color, is linked with about three additional deaths per 100,000 people per year. And that's similar in scale to the average annual risk of death from alcohol impaired driving nationwide. So if you're in an area that has an increase of 0.5 or greater, that's similar in risk to kind of adding the additional risk of drunk driving. What I want to note here is that these risks at an individual level are low, right? Each one person, if you're one person in a community, um, the risk of dying from influenza or the risk of kind of dying from alcohol impaired driving is low. But at a population level, these can be a sizable increase in risk. And we often at a community level make decisions on how we can maybe try to reduce that risk. For influenza, we get vaccines. For drunk driving, we have laws around this. So I think it's a helpful way to kind of contextualize how we think about increased risk from a pollution plant. I'm zooming in even more here. So now we're not even looking at census tracts. We're looking at towns and census designated areas in that are going to be affected. And what I'm showing here is I have the outline of these different towns and census designated areas, and I'm coloring them based on the average increase in pollution from this plant. Again, the blue dot represents where the plant is located or proposed to be located in Southaven. And what you can see here is that the increases are most concentrated in areas of Memphis and Southaven and Horn Lake, and extend beyond kind of the immediate vicinity. But it's a helpful way of kind of understanding how this risk translates to a smaller geographic area, which is each kind of town level. And I'm actually going to zoom in even further. So this is the same map as before, but now I'm really concentrating on the highest impacted areas. And what I've done here is I've actually broke up Memphis into these different planning districts as a helpful way of understanding that the pollution risk is not equally distributed across Memphis. So we estimate that the most impacts are going to be felt in areas of South Memphis, like Westwood, Whitehaven, um, And again, this is just showing the average amount of pollution from the plant that residents in these areas would experience. So this map shows pictorially and using colors on a map where the impacts are going to be most felt. I'm showing that same information, but now in a table. So it's a little bit easier to kind of rank and understand who are the most impacted towns or kind of communities by this proposed plant. What you can see here is I've shown in descending order the highest impacted areas. So that would be in Whitehaven, which is again a planning district of Memphis, Horn Lake, Westwood of Memphis. I'm showing here also the population that live in these areas based on American Community Survey data and the annual increase in PM2.5. So this is again the amount of concentration on average that people will be that will enter these areas based on the pollution from the plant. Um, and again, it's kind of helpful to have these anchors that I said earlier of how we can think about these annual increases with regards to risk. So Whitehaven, Horn Lake, and Westwood would all be increases in PM2.5 that is above zero point 0.5. And so it's a I would say it is an increase in risk that is not negligible from this proposed plant. I also want to emphasize that a lot of these communities based on EPA monitoring data are communities that already have relatively high levels of fine particulate matter pollution. So these are areas that already are receiving levels that are near or potentially above the federal standard. So that's an important context for who's going to be impacted from this proposed facility. Another thing we do in the report is we look at what's important is not just where concentration is highest, but also how many people are living there, right? We might not be as concerned if there's a higher concentration in an area where people aren't living. So what I do here is I'm making a table of what I'm calling exposure burden. And essentially what you can think about is I'm multiplying the amount of concentration by the amount of people living there. So this is a measure of where are the most people going to be affected from the emissions from the plant? And what you can see is that Shelby County in Tennessee is going to have 63 around, we estimate it to be 63% of the exposure burden from this plant. Even though the plant is located in DeSoto County, that the way that it will spread and also the amount of population that live in Shelby County, which we have here is over 900,000, it means that the most kind of plant attributable exposure burden will be in that county. Okay, so this table is trying to answer the question of who are the people what can we say about the people who are going to be most affected? So on the left, you have a bunch of different metrics that we have measurements on, which is we know at the census tract level what the poverty rate is, what the percentage of different ethnicities is, what the median household income is, what the median property value is, all these different measures. So I want to direct your attention to these highlighted columns. What the first column on the left, where it says above zero point 0.5, and this is again a measure of concentration, what this is saying is we're looking at the highest impacted areas from this plant. These are census tracts where the estimated increase is above zero point 0.5 micrograms per meter cubed. And what we're saying is there are around 89,000 people who live in those census tracts. And what's kind of important to note is that people living in those census tracts are actually different than the average of Mississippi census tracts. In particular, I want to emphasize that there's a overrepresentation of Black people living in these areas, right? It's 73% of those in the census tract that are above 0 0.5 are identified as Black, whereas in Mississippi, the average is 37.2. Another thing to note is that SVI, so this is Social Vulnerability Index. This is a measure that we use in the scientific literature that combines a bunch of measures in terms of health risks, income, and it's a measure of how well a community can absorb a stressor or kind of an impact stressor. And a higher level means that these areas are more vulnerable. What we're seeing is that the areas that are most affected have a social vulnerability index that is elevated, a lot is higher than the average in Mississippi. It's 75.8. What this says is that they're kind of as vulnerable. They're in the upper 25 percentile of the most vulnerable communities in the US. And so this is again a measure of how well could these communities absorb additional stressors like pollution. And again, I want to emphasize the last thing, which is adult asthma prevalence. We know that um, pollution of this type can exacerbate asthma symptoms, has been linked to additional asthma events. And we see here that in the highest impacted communities, there's a higher prevalence of asthma as compared to the Mississippi or national averages. Okay, now this is where we're going to talk about the estimated health impacts and health damages. So again, what I'm doing here is I'm using an EPA tool that was designed to understand, given a screening level estimate of how much additional pollution is going to result in terms of additional deaths, as well as additional health damage costs. And what we have here is that we estimate that over the entire impacted area, this tool says that this plant would be linked to between 1.9 and 2.8 additional deaths, as well as additional asthma cases, around 1,500 cases of asthma symptoms. And this is translated into health costs or health damages. Um, and the estimate is between 30 and 44 million per year in health damages. Now, I want to just note here that that's quite a range, right? 30 to 44 million. And the reason is that this tool presents a range because there's different evidence linking air pollution to additional deaths. And that's why you see this range of 1.9 to 2.8. This is on average. We're not saying we can point out, these three people you know, would die early because of this air pollution, but we know that on average, it's between 1.8 and 2.8. We estimate additional deaths from this facility per year. What I want to emphasize is that this impacts would add up, right? If I say 30 to 44 million per year, what I'm showing here is a table of if we assume that the power plant is going to operate for 20 years, for 30 years, for 40 years, we have, scaled appropriate scaling and costs, right? So this could cost, if it operates for 30 or 40 years, over $1 billion in health damages. And then this is just kind of to show that these health impacts do translate, one, to really significant impacts in terms of costs, but also, is linked to 1.9 to 2.8 additional deaths per year. Okay, I want to end with some of these like higher conclusions and takeaways from this study that I hope you kind of leave with. One is that when we're talking about a gas plant or a fossil fuel turbine, it's really important to look at the impact in fine particulate pollution. And that is because it's one of the main health risks from power plant emissions, and that there is no safe level of exposure that even at concentrations below a federal standard, if we're going to increase the concentration of this pollutant, it's going to have health impacts. The second is that this proposed project would add pollution in a region already facing elevated health burdens. We know that the impacts will fall on communities in South Memphis and kind of other areas that are already near or above the air quality national limits, as well as impacting census tracts that have elevated measures of asthma prevalence, of social vulnerability, and um, and that's a really important context for understanding the impacts of this plan. And the last thing I'll add is that the health damages are large and long lasting. So using an EPA tool, it's an estimated 30 to 44 million per year, which if we have a kind of discounted view would be between 600 and 860 million over 30 years. And also important to mention the kind of linked, it's estimated to be linked to between 1.9 to 2.8 deaths per year. So depending on the lifelong of this plant, this could, scale and result in those estimated deaths. So I'm going to stop here. And thank you for giving me the platform to speak over this report. And I'd love to take any questions you all might have.
Okay, thank you so much, Dr. Cork. Let's give him a round of applause. Good. I mean, I was taking deep breaths throughout this whole thing, just quite frankly. And to be honest with you, a lot of people who are on this call have been attending community meetings, have shown up to try and articulate sort of these concerns to our elected leaders and to agencies, whether it be the Health Department, Mississippi Department of Environmental Quality, but to have the research that supports what so many people have been talking about, since at least 2024 is just really meaningful and powerful. And so thank you for the work that you're doing and the information that you've been able to provide. And if folks have questions that you want to put into the chat here, that would be helpful. And if you want to have access to this presentation and this call as well, please go to votejustinj.com and sign up, and we'll make sure we send this out tomorrow morning, if not tonight. I have a few pre-planned questions, and then we'll look into the chat, Dr. Cork, and see what folks are thinking here. Okay. Let's start with one piece of information that I have. The Southern Environmental Law Center, who we've done work with for years, 6 years now, they helped our community in a fight against the Byhalia Connection Pipeline, which you all will remember were seeking to pollute our drinking water. They were also using and misusing eminent domain to take people's land in our community, but we were successful in that fight on July 2nd, 2021, when they closed down. The Southern Environmental Law Center sent substantial comments to the Mississippi Department of Environmental Quality ahead of their permitting. And one of the things that they talked about was this particulate matter 2.5 that you were teaching us, right? It's like a strand of hair. And if you cut that strand of hair into 30 pieces, right, it's that small, which is why it's so dangerous, because it can get lodged in the lungs, it gets lodged in the bloodstream. And I believe when we were talking, 90% of the health concerns that people have from industry comes from the particulate matter 2.5 being in people's body, being and impacting them. But something the Southern Environmental Law Center said in questioning xAI's permit was that MZX, which is the affiliate that they're using, but xAI vastly underestimated particulate matter 2.5 emissions, rendering the model that they use ultimately worthless. xAI calculated that their 41 turbines will emit only 19.5 tons of particulate matter 2.5 while generating well over a gigawatt of power. And as they write, this is simply not plausible as just one initial example. And you all hear this. The gas turbines at the Tennessee Valley Authority's nearby Southaven power plant, which is only 800 megawatts, is 400 megawatts smaller than what xAI is proposing. They emit 315 tons of particulate matter 2.5. And xAI is saying they're going to generate 400 more gigawatts of power to be 1.2 gigawatts, megawatts of power to be 1.2 gigawatts. And they're only going to produce 19.5. So TVA, 315 with 800 megawatts. xAI, 1.2 gigawatts, even bigger, and yet they're going to just do 19.5. And so the research that you're using is based off the permit, what they've turned in, which is that 19.5, which I understand. But unless there's somehow magicians that have figured something that no one else in the world possibly has, which they aren't that smart, and the technology that they have isn't that good to be able to do such a thing, if it's more likely that they're upwards of 300 tons of particulate matter 2.5, what does that mean for sort of some of the assumptions that are made?
Yeah, thanks. It's really a great question. And I'm just gonna clarify a couple of things. One, I just wanted to add a finer point to the 90%. So like the 90% of air pollution's impacts from pollution, air is through mediated through PM2.5. I just wanted to kind of be clear about that. So again, that's kind of motivating why it's really important to get this right? To actually accurately estimate how much PM2.5 is going to leave a specific facility. And to your question of, okay, if there's more PM2.5 that will leave this facility than what is in the air permit, again, it's hard for me to speculate on whether that number is accurate or not, but what is reported is 19.6. If that were actually to be a lot higher, then we would see a scaling in the amount of impact of this facility. We would see, right, that number, this 30 to 44 million, that would be much higher and it would scale with how much additional pollution. So that's a really important thing to get right and to understand that this analysis was done under what was submitted under their air permit.
Exactly. And that's the thing. I believe and all of the research that we have shows also, just comparing it even to TVA, y'all, they likely significantly under reported how much PM 2.5 there is, which means this amazing research that Dr. Cork is doing is really the harbinger to say there's likely going to be millions more in damages and likely a lot more people prematurely who pass away because of this pollution. Let's go to a couple more questions here. Can you talk a little bit more about you mentioned how people in Shelby County are going to be impacted at about 63.79% when it comes to this pollution. That's sort of that population that's going to be most impacted. Because some people say, uh, Representative, this is in DeSoto County. You all shouldn't care about it. But the
Yeah,
reality is the air doesn't care, right?
yeah,
And it seems like even though the facility is going to be in DeSoto County, and we know it's wreaking havoc on our siblings and family members in DeSoto County, from the noise pollution to the air pollution. The consequences of this are actually going to be in substantially, at least, in Shelby County and all
yeah.
district.
Yeah, I think it's an important thing to consider when we're talking about air pollution is we know that it will not stay in a confined area. And what I'm showing here is a measure of not just where the concentrations are highest, but also where the most people live. Because when we're looking at health impacts, we care about who are the people that are going to be exposed. And what this is showing here in terms of the total exposure burden or the facility, that 63 or over 63% of that is going to be concentrated in Shelby County because there's a much more larger population that lives there. And also we know this facility is not too far from the Tennessee border. And from our maps, we can see that, there are areas of Tennessee that will have a large proportion of that additional pollution is going to fall in those areas.
Thank you so much for that. So for people who are in Shelby County, I think you have another graph here where it shows Westwood. That might be it, right? But you all can see Whitehaven, Westwood, right? South Haven, Horn Lake, like these are the places that are going to experience the effects of this the most. And again, we can't pinpoint exactly where people are going to get sick or prematurely pass away and things like that. But this is showing where that elevated risk really is, which is why all of us have to be concerned when facilities and companies like xAI, through this affiliate MZX, are coming into our communities. We have a right to clean air and that requires us being engaged and understanding. This goes all the way to Arlington, right? Into Collierville, over into Arkansas. It isn't just Westwood's problem. It isn't just Boxtown's problem. It isn't just Whitehaven's problem. All of our air quality is suffering. And right now, we know we're out of attainment as it relates to the EPA and the levels of smog that are supposed to be allowable. But again, there are no healthy levels of pollution. And I saw something on the TV the other day where several people were talking, and all of them said, I don't live near xAI and I don't want to live near it. But then they were mad at us because we keep speaking, we keep getting research, we keep sharing information. And they say we're just supposed to accept this pollution, accept this cost, accept this burden because we're going to get a couple of dollars in tax money. This is why facts matter. And this is why we have to have strong leadership to help us to understand what's going on here. I've got a couple more questions, then we're going to go into this chat. Okay. Um, and Chris, I see your hand, but I'm going to ask you to type into the chat so we can get through more questions. Okay, my friend? You mentioned here, oh, no, 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 is particulate matter, PM 2.5, is this the only pollution coming from this plant that we should be worried about? Or are there other types of pollution that are likely to be coming out of these 41 gas turbines? And again,
Yeah,
remind everybody, we're using just the information that they have provided. So this is that based on their information. Go ahead, Dr. Cork.
yeah, that's a really great question. So for this analysis, we focus again on PM 2.5, given that it's one of the biggest health concerns and we have so much scientific evidence on it. And we also have this evidence that they present in terms of an air permit. There are other pollutants that are definitely worth thinking about. Formaldehyde is one. And there's also other types of concerns. We have, people are talking about noise concerns, impacts on water. These are all things that are beyond the scope of our analysis. But I think it is important to consider that this is not, the entirety of the impacts of the plant, right? We're looking at a really major impact through PM 2.5. But again, this analysis is kind of restricted to just that pollution.
Mhm. That's extremely helpful. And I think there's somewhere where is it sulfur dioxide and some other ones that will likely be coming out of here?
Yeah, actually, I'll add a little finer point to that. So there's other criteria pollutants that I think actually might be helpful to this, like, because on the bottom, I talk about how I arrived at this number. So in the air permit, there's 19.6 tons of primary PM2.5, but they also have pollutants, these other criteria pollutants like sulfur dioxide, nitrogen oxides, and volatile organic compounds. Why these are important is that these gases will contribute actually to fine particulate matter over time. They are released into the atmosphere, they react to the light, the moisture there, and over time actually create particles that contribute to what we call secondary PM 2.5 formation. Um, so these are also really important to include. And what I'll also add here that is done in this EPA model, but is not done in the maps that I'm showing, is that ozone formation is another important thing to consider. So in these health costs, they estimate the impact of ozone. But when I'm showing these maps of kind of these different colors, I'm only looking at PM 2.5. So ozone's another thing to consider that we know is linked to health impacts and premature deaths.
And can you talk about that just a little bit more? Because we're actually in April, Memphis Community Against the Pollution, that my brother Keyshawn Pearson leads. I'm fortunate to be one of the chairs, and I know one of our board members, Ocean our Gillian Pearson, is here. We're going to be releasing a report about sort of ozone and the implications of that. Can you talk about how smog impacts people's health and sort of like the connection to the research you have here?
Yeah. So another actually really important thing to note here is what I'm looking at here is the impact of long-term PM 2.5 exposure. So all of these maps that I'm presenting is concentration averaged over a year. And why we do this is because there's a lot of scientific evidence linking long-term exposure to health impacts, kind of similar to smoking or other mm, kind of types of exposures. It accumulates over time. Um, However, there's also short-term impacts, right? So if you were to have certain days where you have a lot of fine particulate pollution, or maybe there's a weather pattern and maybe an inversion of temperature, which would create kind of a lot of pollution in the air, this would potentially have its own impacts. And I want to emphasize that our model, what we're doing here is not looking at the short-term impacts of exposure. And those might translate to kind of more acute instances of hospitalizations or kind of days where people with asthma symptoms might be elevated. But in my report, I'm looking at just the long-term impacts, which are really sizable. But it's important to keep in mind that there might be short-term impacts as well if you have specific weather patterns that is more acute events.
That makes sense. And particularly when we're thinking about the level of heat that we have, when this pollution is going up into the air, interacting with the heat, those are the volatile organic compounds, right, that become smog that people are then breathing in, which is why you get those code orange days, which we continue to have more and more and more of. And this again contributes to that. Let's see some of the questions that we have here. Can you talk about that risk? And we were talking about this when it comes to the increased risk for our community having this plant is similar to if we increased the amount of risk for drunk driving or increase the amount of risk of someone having the flu.
Yeah, I'd be happy to. So I think this is a important thing to really explain. Why I think it's important is I want to give an understanding of how an increase in pollution translates to some risks that we have maybe some intuition behind. So what I'm saying here is if you have a long-term increase of a certain level of 0.15, which is the amount of concentration, yearly average concentration of pollution, that we translate to about one additional death per 100,000 people per year. Now, that measure, which is one death per 100,000 people, is actually similar in scale to what the annual risk of death from influenza in the United States, which is 1.2 additional deaths per 100,000. So it's a way of relating how we think about an increase of pollution to an increase in risk that we might have a little bit of a better understanding around. Um, and a long-term increase of about zero point 0.5 is linked with about 3 additional deaths per 100,000. So this would say on average, right, if you had a town of 100,000, this would be on average about 3 additional deaths. Now, again, I want to emphasize something that was repeated multiple times. We don't know exactly who is going to be, impacted by this, but these are average measures of using scientific evidence of how much impacts this would be. And again, 3 deaths per 100,000. The annual risk of death from alcohol impaired driving in the United States is around 3 per 100,000. So this is just again a way to kind of anchor these impacts into risks that we might understand at a population level, and to give a little bit of intuition behind, what how we think about population level risk. We often make decisions to mitigate some of these risks. Um, and it's important to really understand what we are setting, what we are doing when we're thinking about risk. So that's kind of the reason I've included those, mostly to just anchor these into our minds and give us some understanding.
Yeah, it's inviting additional risk of death into our communities, which if you said, do you want me to increase the risk of you dying similar to the increase of the flu or increase the risk of you dying similar to getting in a car wreck? Everybody would say no, no, thank you. But alas, here we are. Eric, I see your point. No one spoke in favor of this power plant at the hearing that was held in South in Mississippi in DeSoto County, and we want to put a stop to it. And I'm right there alongside you. And you should know all of our coalitions are working to figure out what our next steps are after this approval was given by the Mississippi Department of Environmental Quality. And so stay tuned for Memphis Community Against Pollution, Young Gift and Green, Southern Environmental Law Center, Safe and Sound Coalition. Like we're not gonna quit, but it's also time for Mayor Musselwhite, Mayor Young, Mayor Lee Harris. They all need to look at this information and stand with us to demand that xAI do differently. Will PM 2.5, this is from Sarah Gladney, will PM 2.5 show up in one's blood work? If so, what type of blood test is used to determine the amount in the blood?
Yeah, this is a great question. I'm not actually an expert on understanding the kind of clinical presentation of PM 2.5. So, but I don't think there's a specific blood test for this. I know that PM 2.5, the way people often think about it is it can increase different inflammation responses and other things. But I am not aware of any test measuring PM 2.5 in the blood.
Mhm. And I think in an early slide, you mentioned some of the deep concerns about PM 2.5 is that it can increase, does it increase heart attacks? I mean, there's like a litany of things, particularly for people who have comorbidities that are deeply concerning. Heart attacks, strokes, asthma, lung disease, and obviously premature death. And so we're likely just to see a population level increase in this due to the amount of pollution and something that Dr. Cork mentioned that I think is really important to double click on here, y'all. Our community is already overburdened, right? The TVA has a power plant down in Southaven, Mississippi, just like they do in Southwest Memphis. Nucor has a facility. Valero Ore Refinery has a facility. Tennessee Valley Authority has another combined cycle plant that they just got approval for 6 more gas turbines. So we're already vulnerable. And our what is the SVI, our social vulnerability index, already says that our community really can't take on additional burden because of what we're already going through. And that's due to all of the concentration of polluters who keep exploiting our community and are given a green pass to do so by our elected officials. Um, Victoria Terry, I see your question. Has any data been presented about the energy cost to locals with these data centers? That's not specific to this one because this is more about those environmental concerns. But I do know across the country, a lot of people's energy costs are going up because the data centers are using so much of the power grid. What xAI is doing is, in essence, trying to bring their own energy off the grid while using dirty gas turbines to do it, which is may not have as much impact on people's light bills necessarily going up, but obviously is having serious implications on people's health and well-being. What about mothers who have children born with defects? It's a good question. And Latricia Adams, president of Young, Gifted, and Green, has done a lot of work on this. But I would assume, and Dr. Cork, you would know better here, the increase in PM 2.5, likely for someone who's pregnant or young children and adults, it has even worse of implications.
Yeah, I don't, off the top of my head, there are definitely risk groups that I know clinicians would have a better understanding of the impacts. A lot of my work focuses at a population level, so I don't want to speculate too
Mhm.
much, but we do know that there are specific vulnerable groups, and that's a really important point to consider. And kind of back to the point of when we looked at different impacts, we know these communities are kind of overrepresented at a higher social vulnerability index. We know there's more asthma prevalence. So we know that there are different impacts. There's also work from our lab looking at the exposure to PM 2.5 amongst Black Medicare proponents versus white Medicare proponents. Those are 65 and over, that showed that there's actually higher risk for Black individuals in that Medicare population. So there's also some evidence to suggest that this risk is higher for older Black Americans, and we have evidence that this is going to be concentrated in neighborhoods that have a higher percentage of Black people. So there's a lot of, I think it's really important to think about vulnerable groups, and there's kind of scientific evidence out there to support that that's an important consideration.
Thank you so much for the question. And Beverly Davis, I see you here. I represent 7 schools in Whitehaven. What do I tell my parents at the elementary schools? So are we not to let the kids outside to play? I mean, I think kids are going to go outside to play. I think the truth of the matter is we're going to have to be even more hyper vigilant about the days that they are outside and when they are. Last year, we had a kid at one of our schools who was outdoors on a code orange day, and he tragically passed away. And we are going to have to be hyper vigilant. But the other thing, Ms. Beverly Davis, we have to ask is, where is your city councilor? Where is your county commissioner? Where is your mayors? Where's your congressman? Where are your elected officials in helping to fight for those elementary school kids and those parents? Um, uh, because we shouldn't have to be in this fight in the first place. But it's time not just for you to continue to do the work of representing and your school board members. Where are they? And helping to preserve the clean air of your community. Um, we all have a right to clean air. Thank you, Duffy Marie. All know. The map shows the communities who will be impacted, which are a lot of communities. It's not, again, just Boxtown, Westwood, and Hernando and South Haven. You can see it all the way up into Arlington, all the way up into Friendship in the northern part of my district near Millington. These are consequences that are going to be all across our county. Rachel, um, yep, it is so hard. I can totally understand that you sometimes feel hopeless to stop them from going in, but I always bet on people power, Rachel, and we have to continue to rise up. I mean, what's today? It's a Wednesday night, and 70 of us are on here learning so that we can be best equipped to fight back. You got to be engaged in the movement. That's the only way I keep getting hope because of people like you and us continuing to show up. Randy, if we're having one-on-ones with local leaders who are responsible for xAI being here and they deny the pollution, how can we push back and take action? Randy, you can tell them that you spent an hour talking with a PhD doctor on what is going on. And you can also share this link with them. You have probably spent more time understanding the effects of this pollution on our community than most elected officials in Shelby County. That's just the honest to God truth. It's sad, but it is true. Take this link when we send it to you. Send it to them on Facebook. Send it to them on Instagram. Send it to them on Blue Sky. Share this so that they won't be able to continue to take the propaganda from the chamber and then tell us we're wrong when we know we're right. Um, I see Zoe, are we allowed to use these graphics? Yeah, we'll be sending this out. And Chris Dennis, there was an article written by a University of Memphis professor which stated that due to the spacious area of the plant, the pollution wouldn't be concentrated enough to matter. Do you think that would be a feasible theory for anyone educated in this topic, or do you think that this could have been straight up propaganda? And Chris is speaking specifically to the plant in Memphis, which they got permitted 15 gas turbines on. But for the one that you studied, the one with the 41 gas turbines, if someone says, well, it's zero point 0.5 miles away from anybody's home, like this pollution isn't going to matter.
Yeah, I'm less familiar with the specific study, but right, what we're doing here is modeling the pollution that is going to leave this plant at the maximum permitted level. So this is, a really peer-reviewed scientific model to try to estimate where the pollution is going to go. And what I'm showing here is that it is enough to have health impacts, and we have an EPA model showing this is, going to be estimates that 1.9 to 2.8 deaths are attributable to this facility across the entire region. So I'd point to kind of the output of our models to and kind of show this is a validated, scientific method of the impacts.
Thank you for that. And then Ocean our Gillian Pearson, what can you say about when we smelled the pollution? Like, do you know like why that is? Like on some days, particularly like humid days, like it's just like it stinks horribly outside.
Yeah, I think that's a great question. I actually don't have a lot of familiarity on why you can smell the pollution. I have to get back to you on that, but mm, yeah.
Okay. And then Ocean has another question. The closer you are, do you take in more fine particulate matter, so PM 2.5? So for those of us who live within a 1, 3, 5, 7 mile radius, how do we lessen the burden of this particulate matter pollution? Many of us have our roots here and are raising families in these highly polluted areas.
Yeah. So when we use this model to understand where the pollution is going to go. It looks at weather patterns, average weather patterns in the region. So, generally, the closer you are to the plant, the more pollution that you will probably be exposed to. But you know, it's not necessarily just about how far away you are. And this kind of map shows this like the average, the way this pollution travels, because it's a function not just of distance, but how the weather patterns are going. So this type of model and this output shows a little bit of trying to get at that question, which is what areas are going to be the most impacted, which are not.
Okay. And then we have um, okay, I see, Satria. The water usage and supply. So there's the plan in Memphis Colossus 1. They have said that they are going to build a water recycling facility. I haven't gotten an update on the building of that. Right now, they have a reuse system. So they're trying to use, in essence, a more efficient system with the water that they currently have at Colossus 1. So they're not using millions and millions of gallons a day. However, the Colossus 2 and Colossus 3, they do not have any promises that they're going to do water recycling. And so the expectation, I believe, from their permit is that they're going to need 5 to 7 million gallons a day. But we'll have to double check that. But we're expecting them to need millions of gallons for the cooling of the 1.2 gigawatts that they're proposing. Um, Let me see. We got about 3 minutes left. Thank you so much. I see Riri there. I'm a maternal child health researcher here, and you know a lot about prenatal exposure with high blood pressure during pregnancy, preeclampsia. One of the leading causes of maternal death in Tennessee and Memphis is high on that list. Joy, working. So my partners at clinics in Whitehaven and Southaven understand these things. Thank you, Dr. Townsend. I appreciate you being here. Um, One of our great neighbors. There's some good articles there, making sure you mask up, things like that. That's great. Is there any action being taken against the chamber? These are the folks I'm meeting with and never want to accept the data. Then the folks are going to die. They just do not care. I really do believe we're dealing in a very difficult and challenging time, socially and politically, where our lives are being considered expendable for the benefit of billion-dollar corporations. And our elected officials overwhelmingly are silent, and their silence is complicity, or they're actively opposing the information and the knowledge. And it's going to be our responsibility to hold them accountable at the ballot box, but also to advocate to them now, to send them this video, to send them this research that Dr. Cork and his team have put together, to demand that they do something to protect our air quality. I mean, there's no way out of this but through it. And we have to organize together. We have to advocate together. And our congressmen, our mayors, our city councilors, our county commissioners, each and every one of us need to be sending an email tonight or tomorrow saying, what are you going to do here to help us with this? Dr. Cork, you have any parting words?
No, it's really encouraging to see so many people show up and listen to this work. I really appreciate you all being here, and it's been an honor and pleasure to be able to start trying to make this data available. I think it's really important to have this data visible to the public because only with this data can we start making more informed, data-driven decisions on how to best support our digital infrastructure while making sure communities are.
Absolutely. And I'll give two last things here, three last things. One, a big thank you to my team, Daphne Thomas. Many thanks to you, our communications director, for your amazing work in helping to organize this. Our district director and our campaign manager, Felicia Boyd, our digital director, Oceane Argillium, and some of our super volunteers are here at 6 o'clock on Thursday, the 19th. We're going to discuss this information again, sharing some of Dr. Cork's research and also some next steps of what we can do. And that will be in person. Thank you, Oceane. That will be in person at the Healing Cathedral. If you thought this was informative and useful, come to that meeting. Bring someone with you so that we can pack out the Healing Cathedral and share the information and get our elected officials to fight for our right to clean air. It's an honor to serve you. It's an honor to be your candidate for U.S. Congress. I love and appreciate every last one of you, and I look forward to remaining in touch as we continue to fight to make Memphis, Shelby County, Mississippi, the Mid-South, the best place in the world to live and to build a family. Thank you all so much. Bye bye.